All right, so sorry about that. I'm Dr. Paul Stanislaw, and I am a facial plastic surgeon in Avon, Connecticut. And I am going to talk tonight about skincare and how to slow down the aging process. So the first thing I want to talk about is in the press, in the news, on the internet, and everywhere you see it, there's so much advertising and sales pitches, and oftentimes this is couched as like real medical information when it's really just a ad. So tonight we're talking about just being really careful about what you're buying into and what to watch out for. And so we're going to just start with the basic stuff. So as I always go over the aging process. And the most important part about the aging process is the skin, right? We have to understand what happens to the skin as we get older. So what I talk about is, the first thing is about the two major proteins of the skin. There's collagen, which is the protein that gives the skin thickness, it gives it toughness. That's how we heal, by collagen deposition. And then there's the protein elastin. So elastin protein is the protein that allows the skin to stretch and contract and to really maintain its shape like a rubber band. So if you think about the skin as a rubber band, when you turn your head, the skin will stretch in your neck, and when you come back, it'll contract, it'll maintain its shape. And just like a rubber band, if you leave it out in the sun, the ultraviolet light breaks it down, it gets older, it gets stretched out, it doesn't want to contract and maintain its shape like it used to. That's the same process that happens to the skin. So I'm going to try my audio visuals again tonight, and we're going to talk about the elastin protein. So elastin protein, I don't know if you all can see this. Do I have this right? There we go. So when we're born, 4% of our skin is elastin protein. And we really just hold on to it for the rest of our lives. We don't make it, you don't make it later in life. I don't care what anybody says. There's no magic machine. There's no magic cream that's going to make you into an elastic rubber band again, okay? And genetics plays a huge role in how we age. So we all know people who age really, really well. And those people are the people that hold on to their elasticity for longer, and then it sort of drops off. And then we know people who age really poorly, and they're very young, and their skin looks much older than their stated age, and that elasticity drops off earlier. So if you just think of this middle line, right? The average, right? Most people, they hold on to it. And then all of a sudden, that elasticity of the skin, it can't compensate anymore. It's sort of lost enough where it's sort of the straw that broke the camel's back, right? So you're doing well, and all of a sudden that happens, and everybody comes in right at this point. And they'll all say, yeah, I was doing really, really well up until this past year, and this past year it all went to hell, right? All of a sudden I see all these wrinkles that I never had before. What's going on? And it's really that the elasticity just can't keep up now. It's just sort of broken down, the elastin proteins. Now, the most important thing and the most cost-effective thing you can do to slow down the aging process. It's not very glamorous, it's not fancy, it's not expensive. It's to wear a good quality sunblock, okay? Nobody wants to hear that. They always want to say, what about a laser? But when I start out saying, well, that one thing, that sunblock, right? It helps you with maintaining your elasticity for longer. It helps with pigmentation. It helps with skin cancers, right? So that is the most important thing that you can do to slow down the aging process. And so right here, right, if you have that same graph, and if you overlay all the ultraviolet light that we get over the course of our lifetime, the sunburns we got when we were kids, when we're out gardening right now and doing stuff outside, all that ultraviolet light breaks down the elastin proteins, right? And it ages you prematurely. And we've all seen those pictures on the internet of like a truck driver where the driving side of the face is all wrinkled and the other side's fine, okay? We all know people who sunbathed a lot when they were kids, and now they look like shriveled up prunes. So that one thing, that sunblock, is super important. Now, about sunblock, everybody comes in and they'll say, well, my SPF, I got makeup in my SPF in my makeup. My moisturizer got SPF. This is what's, I'm fine under the SPF. SPF is not a good measure of a sunblock, okay? SPF only does one thing. It measures how long it takes for you to not get a sunburn or to get a sunburn. So they put like a sunblock on your skin, and they shine ultraviolet light, UVB, on your skin, and they record how long it takes for it to get a sunburn. So if you put that sunblock on there and it takes 10 times longer, it's SPF 10. If it takes 30 times longer, it's SPF 30. The problem with SPF is it's only measuring how it blocks UVB. Now, from the sun, 95% of the ultraviolet light is UVA, 5% is UVB. UVA is the high energy ultraviolet light that passes through glass and it'll bleach out your dashboard. So it's high energy, it goes deeper, right? UVB is the low energy, it's blocked by glass. UVB causes the sunburns, okay? It causes like squamous cell carcinomas where they start on the top of the skin, okay? UVA doesn't give you a sunburn, but it causes the breakdown of the elastin, it causes the pigmentation, it causes the basal cells, it causes the melanomas, okay? So when people come in and they're all brainwashed into thinking, well, this SPF is super important. I got an SPF 50, I got an SPF 30. All that is telling you how long it takes for you to get a sunburn, right? To block that UVB. So you might put on your sunblock and you play the first 9 holes of golf, right? And you go and you look at yourself, you're like, you know what, I didn't get a sunburn, I'm doing fine. I'm gonna go play the back 9 now. Now, what has that done? Your sunburn was your evolutionary warning system to tell you, get out of the sun. And I've just taken that evolutionary warning system away from you, and now you're staying out even longer than you should. So if you had the sunburn, you would have said, shit, I gotta get out of the sun. But now that's gone, you stay out longer. So now you're getting more UVA, you're getting more sun damage, you're getting more risk of having basal cells and melanomas, okay? So what I tell people, forget about the SPF. You need to get your glasses out. You need to read all the ingredients, the little ingredients in there. And the most important ingredient is zinc oxide, okay? So zinc oxide is a mechanical block. It's a mineral. The ultraviolet light hits that mineral and it bounces off, okay? Now, we all think of the white paste that a lifeguard would put on their nose, where it's really thick and pasty. And yeah, that's good, but no one's gonna walk around with white paste on their face. So companies have a patented process where they micronize it, the zinc oxide, they make it into nanoparticles. So now it goes on clear. The cost of that, right, that patented process to make it clear, is that those products cost more money, right? And so you have to, I tell people, just pony up and buy the medical grade stuff. I know it's more expensive, but it's going to go on clear. It's going to not give you pimples. Now you could go to, a large box store, and there's many different brands of sunblock on there, and they're good. I'm not saying that they're, I'd still look for the zinc oxide, but a lot of them will say clear, zinc oxide clear for the face. Well, there's no FDA control of what clear means, right? Well, yeah, it's clearer than the thick paste a lifeguard would put on his nose, but it's not clear by any stretch. So if you went and you bought that, still costing you $25-30 anyway, you put it on your face, it's very thick. It's still a little white and pasty. It's good. I tell people, if you're going to go to the beach and you're going to go and you're swimming all the time or you're out working outside, that's a good investment, right? Who cares if you're a little white? But the good thing about it is that it's very water resistant. It stays on very well. And I'm going to tell you where I fail and most people fail, and I'm very guilty of this. If I don't put my sunblock on before I go out, I am never, ever putting it on afterwards. Like, I just don't do it. I'm really bad about it. I know I should. I know I'm supposed to reapply every 2 hours, but I don't do it. So buying that thicker, less expensive, whiter zinc oxide, all right, is very cost effective. It actually works really well for the water situations, but it's not good for everyday use. For everyday use, you need to use the micronized nanoparticled zinc oxide, where it doesn't give you pimples. You put it on and it really does, it is clear, it really rubs in. So Zinc oxide, 9% or greater. Medical grade is what you really want, a medical grade. I know it's going to be more expensive, but this is something that you're going to use every day. You're not going to buy the medical grade and use it at the beach because it's not made to be water resistant. It's not made to be that thick and tacky. So just buy the less expensive stuff, the $25, $30 stuff for the beach, but use it other stuff for everyday use. Now, when I say every day is super important, okay? People think, oh, I'm only going to put my sunblock when I go out to the beach or I'm doing something. In the United States, the majority of skin cancers occur on the left side of the face, and that is just from driving. So just you running around and doing your errands, going to the store, picking up the kids, going back and forth to work, that adds up so much that you have more risk of skin cancer on the left side than the right side. So it is an everyday thing. You have to be in this routine where every morning you're brushing your teeth, you're washing your face, you're putting your stuff on. You're going to put your sunblock on before you put your makeup on. You're going to let it dry. The order for that, again, I'm a little digressing here, but when you're putting that stuff on, you're going to put all in the morning when you wash your face, wash, gentle toner. You're going to let all that dry. You're going to do your medicinal stuff first, your vitamin C's, your vitamin E's, retin-A's at night. You're going to let all those things dry. And then once it's dry and set, then you're going to put your sunblock on. And then that's going to dry. And then you're going to put your makeup on top of that. That would be the order in which you do that. So zinc oxide, 9%, very important. People ask me about titanium dioxide. Now, titanium dioxide, you think, oh, it's a mineral block. It's just like zinc. It should work. Well, titanium dioxide is very, very safe. Titanium dioxide is a white colorant. You'll find it in most of our medications, our pills. The tablets will have zinc oxide in it, titanium dioxide in it. Even yogurt-covered raisins have titanium dioxide to make it white. So very, very safe. The problem is that titanium dioxide does not block UVA. It's good for blocking UVB, but it's not really good for blocking UVA. So the companies will add titanium dioxide into products to increase the SPF number for marketing purposes, okay? It blocks UVB, it's very, very safe, but it's not doing the UVA. So a lot of times products will have zinc oxide and titanium dioxide. The other problem with titanium dioxide is that they can't micronize that enough. They can't make that into nanoparticles. So titanium dioxide products are always a little bit whiter. So they have to add a colorant or a tint in it, almost like a makeup, to make it a little tanner so it's not white. And that's what happens when you use the titanium dioxide. So still a good product, only blocks UVB, raises the SPF number, doesn't block UVA, and you really just need to look for the zinc oxide. Now, there's all sorts of other synthetically made organic oils that are sunscreens. And what I mean by sunscreen is that this molecule, this man-made organic molecule, it gets hit by a photon of light. When it gets hit by the photon, that molecule undergoes a conformational change. It is technically consumed, and it's done. Doesn't work after that. And that's how it absorbs that UV photon. But once it's used, it's consumed. The thing that I don't like about the man-made synthetic oils is that they do run, they do get in your eyes, they do smell. And I don't know how much people are aware of this, but a lot of people know that, like Hawaii, Florida, they've banned a lot of those sunblock ingredients out of sunblocks because they found that those were hurting reefs. That makes the news. Everybody knows, oh my God, I can't wear this sunblock because it's got this ingredient, it's gonna hurt the reef. What astounds me is that there's multiple papers, scientific papers, that show that 6 of the most common synthetically made organic sunblock ingredients are absorbed into our bloodstream, okay? And people don't know that. Doesn't make the news, nobody cares. We care about the reefs, but we don't care about what's getting in our bloodstream. So the thing for me, and I don't have any papers that say that those things are gonna cause us cancer now or 5 years later, or 10 years or 20 years down the road. Is it gonna cause us to have other issues? I don't know that for an answer, but I can tell you, I don't even wanna take that chance, right? I don't want it. So like for my kids, for my family, I'm looking for zinc oxide, and I'm looking for as few of those other man-made chemicals as I can. So that's about sunblock. That's the one most cost-effective thing you can slow down the aging process. Now, what I say about slowing down the aging process, I will never say, and if I do it's a mistake, anti-aging. There are, and you'll see it in all the industries, anti-aging cream, this is anti-aging, this is going to stop the aging process. Nothing stops the aging process short of death, okay? So there is no such thing as anti-aging. Once the elastin protein is gone, it's never coming back. So it's all about maintaining your elastin protein for as long as you can. I'm not ever going to stop you from aging. My goal is to slow down the rate at which you age. And again, there's people that are genetically challenged, and we want to try to hold on for as long as we can. But for everybody, we want to hold on to it for as long as we can, age as well as we can naturally. So that's the first thing, okay, sunblock. Because it does shift that in quite a bit, all right? So that breaks down elasticity. Then the next thing what I tell people is antioxidants, okay? So topical antioxidants. So topical vitamin A, which is retin A, tretinoin, retinol, they're all analogs of vitamin A. Topical vitamin C and topical vitamin E. Quite a while back, probably, I can't even tell you when, but quite a while ago, tretinoin, retin A, retinol, was found to help with acne. So a lot of people were using it for acne. And lo and behold, when these people used it for acne, not only did their acne get better, but their wrinkles started to get better. And then it started so that people started to use that for cosmetic reasons. So tretinoin, retin A has been around for a long, long time. And it's an antioxidant. It helps you maintain your elasticity. Then there's topical vitamin C and topical vitamin E. All three are antioxidants. All three work on different enzyme pathways. And what do antioxidants do? All they do, in its simplistic term, is they help maintain your proteins and stop them from breaking down, okay? So if we look at this graph, I don't know if I can show it to you all right? So if at birth, 4% of our elastin protein, that's what makes up our skin, we hold on to it to a certain point. And then say we're 50 years old, okay? And we start the topical vitamin C, topical vitamin A, topical vitamin E. What does that do? All that does is it shifts this curve out. It does not grow it. I'm not going to give you retin A and make you into a rubber band again. Okay, that rubber band is shot. Say you start it when you're 60. It will still shift this curve out, but you'll see if you start it later in life, you're never going to catch up if you started it when you were 50. So the earlier you start these antioxidants, the vitamin C, the vitamin E, and vitamin A, the better you will hold on to it. The later you start, you've lost a huge percentage already. So what I tell people is, if you come in and you're 70 years old and you have wrinkles all over, I can give you the vitamin A, the vitamin C, vitamin E, but the damage is already done. It's not going to hurt anything, but it's not going to make those wrinkles go away. Now, if you started that when you were younger, you would be much better off. So the earlier you start that, the better off you're going to be. That begs the question, do you start it when you're 18? Do you start it when you're 20? Do you start it when you're 30? When do you start it? Really, from a skin standpoint, once we hit 30, it starts to break down, okay? As people go through hormonal changes, as they lose their hormones, their skin goes through a drastic change, right? Their skin gets thinner, it gets drier. So usually I tell people, maybe mid-30s, early 40s, you're going to really start. Let's sunblock your entire life. Even when you're little kids, you should be have your little kids doing sunblock, of course. But from retin A, vitamin C, and vitamin E, mid-30s, early 40s, I wouldn't say, you're 20 years old, you got to start retin A. Probably there's no harm. I don't think there's any harm with doing that. But I look at it as, is it really cost effective to start retin A when you're 20, when you're still doing well with your elasticity? probably not so cost effective. I don't think it's going to hurt anything, but I don't think it's a good expenditure of your money. So, retin A, vitamin C, vitamin E. Now, if you look at the three of them, the retin A or tretinoin or retinol, okay, are the strongest of the three. And for all of those, they have to be, you have to learn how to use them. And a lot of people will come into me and they'll say, well, yeah, my dermatologist gave me the retin A and I put it on, I had a reaction, I was all red and stuff, and I stopped, I threw it in the drawer, and I wasn't compliant. That doesn't do anybody good. So the most important thing with retin A is the education, okay? You need to understand how it works, what it's doing, and know how your body's going to react to it. Because if you're not educated, you're going to overdo it and you're going to fry your skin. So a little bit more about retin A and retinol. So historically, retinol is the over-the-counter vitamin A analog, so it's weaker. And tretinoin or retin A is just the brand name, tretinoin was the prescription strength. And even the prescription strength came in like a weaker, a medium strength, a higher strength. So the highest strength you can do of tretinoin is 0.1%. Comes in different creams, gels, and carriers. Doesn't matter so much. Basically, I tell people just stick with the creams. They're more forgiving than gels. Gels will dry out your skin and make it more irritating. The tretinoin, I would tell people, it's a prescription, it's stronger, and I would have patients coming in, well, I'm going out and I'm buying this $150 retinol and blah, blah, blah. And I ask them, well, does it irritate your skin? No. Does it make it red, flaky, or anything? No. It wasn't very strong. It's better than nothing, but it's really not as strong as if you did the prescription strength. Now, things have changed though. Like what I used to say is not really true anymore. A lot of these medical grade companies have gotten so good at making the retinol stable, right? So it stays longer, its shelf life is better, it doesn't oxidize so quickly, it preserves itself longer. They're making it purer and they're allowing it to penetrate the skin better. So a lot of these medical grade retinols now are, in my mind, almost as strong, or in some cases stronger, than the prescription tretinoin. So even though in the past I would say, oh, the retinol isn't thing, that's not true anymore. The medical grade ones can be very, very strong. And you really do need to work with an esthetician to talk to them about your skin, because everybody's skin is different. Some people have thick, tough skin, and you could go super hard, really fast, and they're not going to get red, they're not going to get flaky, they're not going to get irritated. And then you have other people with very, very sensitive skin where even if you do it once a week, they're getting really irritated and you might have to go to a milder version of it. Now, when we're doing retin A or tretinoin or retinol for that matter now, you have to realize that it is a delayed response with your skin. So how I tell people to do retin A is we're going to do this at night. So at night, you're going to use a gentle cleanser. You're going to wash off your face. You're going to wash the greases, not aggressive, nothing. You're not using Dial soap, and I shouldn't say that. Dial soap's a good company, but you shouldn't use very aggressive soap, strip all the oils out of your face. You should use gentle cleansers. You wash your face with the gentle cleanser, you let it dry. Now, it's super, super important that your skin is dry before you do this. So when you are doing the retin A, a lot of people, and they're not wrong, but it's not how I do it. They'll say, take a pea-sized amount, put it in your hand, and then take it and dab it and go and dab it and go. I find that when I do that, when I do a pea-sized amount, the first areas get a ton of it, and the last area gets nothing. So the way I do it is just imagine the end of the tube, take my finger, just wipe it, and then I go as far as I can. So the goal of this is to keep this whole skin container as elastic as possible. Not just sections, but the whole thing as elastic as possible. Because you could have a great rubber band, and if one section's blown out, it's still a lousy rubber band, okay? So we want to keep this all as elastic as we can. So I'll do that, and I'll take it, and I'll go as far as I can, all the way up to my hairline, all the way up to my hairline. Now, what I don't do, I leave about a ½ inch above my eyebrow, because if I go right down on my eyebrow, I find that that product migrates down and it'll start making my upper eyelid flaky. So it actually moves down. So I'll give it about a ½ inch. I'll do this area called my glabella. I'll do here. I do under my eyes, right? So I'm getting the crow's feet. I'm getting this area. I'm getting as close to the lash line as I can. What I don't do is I don't do my upper eyelids, because again, gravity is going to bring that down into my eye. It's not the end of the world if you get in your eye, but it's not really fun either if you get in your eye. But you're going to go under your eyes all through here. I do my nose. I do my upper white lip. I'm doing all the way out to my ear. I'm doing my chin. The areas that I don't get in the corner of my nose. If you put too much in here, it's going to get cracked and irritated. And I don't do the corner of my mouth. I'll still do my upper white lip, but I'll go around here a little bit and give this a little bit of birth, because when this gets cracked and irritated, it sucks. You don't want to do that. And I do here, and then I'll do my neck. Now, what's very, very important is that you need to think of the face in subunits, in different structures, right? So the forehead, lower eyelid, cheek, perioral, neck. They're different skins. This is super thin. This is thicker, okay? This has more sebaceous activity. This is no sebaceous activity, okay? So you have to think of these in different subunits and treat them differently, because for the neck, because the skin is so dry, it has very little sebaceous activity. It doesn't have the hair follicles in women. This area, you put retin-A on here, it's going to get dried, itchy, red, scratchy. You'll be like, oh, this is horrible, right? Because it's not tough enough. It can't handle it. You might do your forehead and it doesn't do anything, right? So those different areas have different things. So when we start tretinoin or retinol, I usually tell people we're going to start out really, really slow. Okay, depending on the skin. If someone's got tough skin, I might go harder. If they got really sensitive skin, we'll go lower. But just say we'll start off once a week. All right, so once a week, we're going to do the tiniest bit of retin-A, more is not better, of our face and our neck. Now, as you do this, and you're doing this, all right, you're going to just try to get this to rub in. And then you're going to let that dry. Now, you have to realize that the next day, nothing's happening. You know, it doesn't get red, it doesn't get irritated, because this is in a delayed effect. Okay, so I'll tell people, all right, do it once a week. You do it too much, you're going to get irritated. And they'll go home and they'll do it Wednesday, right? Thursday rolls around. My skin is good. There's nothing. I'm not irritated. My skin's tough. That doctor doesn't know what the hell he's talking about. I'm doing it again because I want these wrinkles gone tomorrow. And they do it again. Friday rolls around. Nothing happens. I'm good. I can do it again. Saturday rolls around and their face is on fire. It's irritated. It's red. It's flaking all over. These people think they had an allergic reaction and they throw it in the drawer. Okay. So when people tell you go slow, it means go slow. When I tell you less is better than more, it means don't put too much on there, because it's going to get irritated and it takes a couple days for that to happen. So you'll do it once a week for 4, 6, 8 weeks. And then, and what you'll notice is that when you go slow, certain areas will be a little flaky. So periorally, because there's so much motion there, this will get flaky. And that becomes like a rate limiting step. You're putting it on once a week, and a couple days later, this gets flaky. And this flaky is just weird. You can't loofah it off. You can't scrub it off. You can't moisturize it off. It just keeps coming, okay? So you might be, look at yourself in the mirror before you leave the house, and you're fine. By the time you get to work, it's all flaky. So you're going to go slow. You're going to listen to your body. So it's going to get flaky. That's normal. So after a couple weeks, it stops getting flaky. Your skin's acclimating to the stuff, and you can use this more frequently. So after a couple weeks, you do it twice a week. Twice a week, you do it, and everything's good. Okay? Do that for 6 to 8, like 4 to 8 weeks, depending on your skin and your sensitivity. And you bump it up to 3 times a week. Now, say it starts getting too irritated 3 times a week. Don't quit. Just go back to twice a week. Do it for another couple months. And then gradually bump it up again, and your skin will acclimate to it. This is not a race. It's not go as fast and as hard as you can. There are some people, the goal obviously is to do the highest strength every night, but some people never get there. They just don't. Like some people, their skin is too sensitive. They can't do it. And some people, it takes them a year, 2 years to get there. But what I tell people is, even if you do it once a week, it's better than not doing it at all. So go slow, realize it's going to make you red and irritated. Now, when it comes to the subunits, this is really sensitive. I can tell you that in my practice, I probably have a total of only 5 patients that can do Retin-A every night to their neck. And that's out of a lot of patients. So it's pretty rare for you to be able to do that. So you might do this once a week, and this area 3 times a week, this area twice a week. Under the eyes, this is very thin. It gets really dried out very easily. And they might go under here twice a week and do here 3 times a week. So just break it up, you know. So if this is stronger, you might go this 3 times and this twice a week, and just be strategic about it. Talking about the neck. When I do it, I'm going from sternocleidomastoid, I'm doing the whole front here. I'm trying to keep this as elastic as I can. I'm going all the way down to my clavicles, okay? Don't forget to put your sunblock on your neck. Sunblock, neck, down to your décolleté, your whole chest. Don't forget your ears. Don't forget the back of behind your ears, okay? Especially if you wear your hair up a lot or you have short hair. What I tell people is that this area, you have to protect this area as much as you can. And when you're a kid, you don't. You're out there, you don't cover it with the sun, you want to be tan, you get all the sun damage to here. Once this gets wrinkly, once it gets all pigmenty, once it looks like, so you'll see patients or people where their chest in this whole area is really red, where you could just take your finger, press on it, and you blanches the red out, and then it comes back red. Once it gets old like that, there is nothing you can do. There is no laser, there's no chemical peel, there's no cream that's going to reverse all that damage. So when people come in like, oh, I hate this, look, this is so crepey, this is so crepey. Once it's blown out, it's done. There's no surgery, it's it. So you got to always protect this from the sun. If you go to the beach a lot, I want you to buy a rash guard shirt, like those surfer shirts that block the ultraviolet light, the UPF, that covers up here. And if you don't have that, you're going to sunblock the heck out of this, okay? But realize that you can do Retin-A down here, but it's super sensitive, and you got to go really, really, really slow. Even vitamin C and E, which we're going to talk about next, much weaker, right? It still makes this irritated where it's itchy. So you're going to have to go slow with this area. But don't forget it, all right? We need to keep this elastic just like this part is elastic. So Retin-A, tretinoin, vitamin A, retinol is the strongest of the 3 antioxidants. And then there's vitamin C and E, topical vitamin C and E. These products really became popular in the 90s. So back in the 1990s, all these medical grade lines came out, vitamin C and E. And they were funny because you cracked them open and within a week they would oxidize, they'd lose their potency. They didn't work very well. So over the intervening years, they've gotten really, really good at stabilizing it so that the shelf life is much, much longer. They've gotten really good at purifying it, making it the active ingredient, the L-ascorbic acid, as strong as they can. And they've gotten really, really good at getting the carrier, getting it into the skin, getting it to the bottom of the skin so where it can have its effect. So again, you get what you pay for. Yes, you can buy vitamin C and E at every box store, everywhere where it is, but they're not stable, they're not as purified, they're not penetrating. Just use the medical grade stuff. Also, I would suggest when you're buying the skincare stuff, you buy it from a reputable source. There was a study that I saw back several years ago that a very major online retailer, like online sales, that 70% of the skincare products that were bought off of that site were counterfeit. I don't know if it's better now. I doubt it. But a lot of that stuff was counterfeit. So when you're, I know it's going to be cheaper. Oh my God, I can save $10. But you're not really sure where it came from, the origin. You don't know if it's counterfeit or if it's real. So when you're buying skincare, buy stuff that is that you know where it came from, that you know it's real, and it's not a counterfeit product. So the C and E's, they are, again, antioxidants. They're maintaining your elasticity. Vitamin C is ascorbic acid. The thing about the vitamin C and E is that they cannot be in a water vehicle or carrier. They have to be in an anhydrous preparation, meaning that the C and E has to either be in a serum or an oil that has no water in it, or an anhydrous paste, sort of like a toothpaste that feels really, really dry. So when you're putting this L-ascorbic acid on, and the reason that the vitamin C and E are usually together is because they both need the same environment. They shouldn't have water in them, and they need to be in that anhydrous preparation. So most medical grade companies will combine the two. I guess you could buy them separately, but almost invariably they're always together. They're always in an oil or a serum or that paste. When you put the vitamin C and E on, it's super important that your skin is dry. All right, so people miss this step all the time. Oh, I wash my face, I cleanse it, I use my toner, and it's still kind of damp, and I'm putting the C and E on. That water and acids don't work well together. Water dilutes acids, right? It makes this not as effective. So when you put on the C and E, you want to make sure that your skin is all completely dry, and you're putting it on and you're letting it dry and set. So again, when you're doing your skincare, you're going to wash with a gentle cleanser. You're going to do a toner, which is kind of like a degreaser. So the oils of our face the oils of our face are a protective barrier. They're there evolutionary for a reason. It's to keep acids and other things from hurting our skin. So they are a barrier. But they also prevent some of these medicines from penetrating your skin. So if we prep the skin a little bit better, not dry it out, not strip it of all its oils, but if we prep it a little bit better, we're going to get better penetration of those medicinal products. So we're going to cleanse our skin, tone it, we're going to let it dry, we're going to do our medical grade stuff. Either retin A at night, vitamin C and E in the morning. If someone has rosacea, you might be doing azelaic acid. If you have melasma, you might be doing tranexamic acid or hydroquinone. So you're always going to do your medicinals first, let it dry. Then it's the sunblock. The sunblock often acts as a moisturizer. Like people say, well, my moisturizer's got SPF in it. Yeah, but it's not a real SPF. Is the sunblock a really good moisturizer? No, but I'm more concerned about how well it is a sunblock. So a lot of times just by putting the sunblock on, it'll act as a moisturizer, it'll act as a protective barrier, let that dry, and then you're gonna put your makeup on. At nighttime, you're obviously not putting your makeup on, but you're gonna wash your face, cleanse, dry, do your tretinoin, your acid at nighttime, let it dry. There's a lot of people that feel that they want to do moisturizers at night. There's a little bit of a debate about that, and I don't really know what the correct answer is, but I'm going to tell you the two sides of that story, or the one side of that, the one theory behind that. So say you do your retin A at night, and you put it on, you let it dry, and then you put your petroleum-based or non-petroleum-based moisturizer on your skin, and you put that on there. Some people feel that that acts as an occlusive barrier, and it makes the tretinoin stronger, it makes it more powerful. That could be a good thing or a bad thing, could be more irritating. For me personally, what I do is I wash my face at night, dry, put my tretinoin on. In the morning, I wash my face with a gentle cleanser, let it dry, and then I'm gonna put not really let it dry, but put my moisturizer on if I'm just gonna put moisturizer on, or let it dry, do the C and E, and then my moisturizer. In regards to, and so that's the CE and the retin A. The C and E's I don't feel are as strong as the tretinoin. I think if you ask me what's the two most powerful, most cost-effective things to slow down the aging process, it's the sunblock with zinc oxide, and it's retin A, tretinoin. And then after that, add the C and E. Now, there's some people that like to hammer it hard with retin A. All they're going to do is retin A until they max out. I really don't like doing it that way because, again, Retin-A can be drying and irritating. What I like to do is play on the synergisms between the three antioxidants. So the vitamin A, the vitamin C, the vitamin E, they all work on different pathways. So if I'm working on all three of those pathways, I feel like the synergisms are going to be better than if I just choose one and hammer it hard. So I like to do it that way. So I'm all for doing little bits of all of them and trying to keep it not as irritating and keeping people compliant. The biggest thing here is keeping people compliant. There's nothing worse than spending money, buying a tube of stuff, and not being compliant with it. It doesn't do you any good, doesn't do the person who sold it any good. So it's really important about trying to make this as user-friendly for the person. To that end, I also recommend that all of you who are investing in your skincare, taking care of your skin, use the people who sold it to you as resources, right? Don't just quit it. If you're having an issue, call up the person who gave it to you, talk to them, ask them what you should do. All right, don't just stop. So very, very important. You're giving those people good money. You should ask them if you have questions. You need to be compliant. Now, and on the same compliance spectrum, we're going to talk about under the eyes. So I tell people to do under their eyes, right? Like do the Retin-A right through here, and that skin is thin and it dries out really easy. So when the Retin-A makes your skin flake, all that dead skin flakes off, well, that dead skin actually does do something. That dead skin is a barrier. It traps moisture into your skin. It traps that. And so as the Retin-A goes there and that dead skin flakes off, you're losing that protective barrier. The skin's going to dry out more. And when this skin gets dried out, it starts to look like a wrinkly, dried up raisin. And people say, oh my God, I'm doing this Retin-A and I'm looking worse. Oh, this is bad. I got to stop. Don't stop, all right? That is going to happen. So go slower. Don't go as hard. When you do under here, okay, I'm going to tell you, use a moisturizer more. Now, again, there's a lot of debate about this. There's some purists who say, well, if you start doing moisturizer on there, and I'm not talking right afterwards, but if you start after the next day you start putting moisturizer, you're going to slow down the response that you had. You're not going to have as good as or quick as response. That may or may not be true. I don't know the truth of that. It might be a wives' tale. Who knows? But I look at it this way. If you're doing it and that's getting dried out and wrinkly and you quit and you're non-compliant, it doesn't freaking matter, right? So I tell people if it gets wrinkly, put the moisturizer on there. I don't care if it slows it down. Just put it on there. Make it happy. Make it smooth. So that you're compliant. Now, in regards to, I talk a lot about drying out skin and stuff. The number one mistake that I see is that a lot of people, especially I think, we're also worried about bacteria and viruses and this, and then we come home, and I will tell you that I'm kind of guilty of this too when I'm operating and stuff. I'll come home and I'll scrub my face like a crazy man because I want to get all that stuff off. The more we use those aggressive cleansers, the more we do that, the drier we make our skin, and our skin becomes unhappy. It is dried out. It's in a lousy environment. Especially in the winter, it's going to be dried out. It's going to be more red. It's going to be more irritated. And I can't tell you how many people come in and they're like, I've got all these red patches, and people, it's rosacea. It's all this rosacea. And I asked them what their skincare is and what are they doing, and they're all stripping the oils out of the skin. Their skin's so unhappy because it's been whipped to death. I'm like, just stop that, add a moisturizer, go slower, use a gentle cleanser, and a majority of those patients, it'll all clear up. It'll all go away. The skin's now in a happy environment, and it's going to be better, okay? So it's not, a lot of people don't even use soap on their face. They just let the water run on. A lot of people don't use hot water. They just use cold water. I think there is some, validity to that, minimalist is probably not so bad. It doesn't strip it out, doesn't strip all the oils out. But I think a middle ground, like the extremes are always bad. Don't do anything or do it too much. I'm not a big extreme person. I like finding a middle ground that makes sense, that's intelligent for you. So, if you're working automotive and you're under a car and you got grease all over your face, yeah, you're going to have to do that. You can't just put water on your face. You're going to have to take care of it. With makeup and makeup cleansers and taking off makeup, I don't have much experience with that. I cannot talk to that, really. I think that there's probably a zillion brands out there, and you're just going to have to find one that your skin's happy with, and it's not too drying and not too irritating for makeup removal. The next thing I'm going to talk about a little bit is, we're talking about vitamin C and E. I'm going to talk about the hands. We talked about the neck. We talked about the face. The hands are really tough. I wash my hands 10,000 times a day. My hands look dried out. I don't know if you can see it, but they're cracked, they're red, they're irritated. I can't put moisturizer on fast enough to prevent that, just because I'm washing my hands all day long, because it's just part of my job. But it's hard to take care of this skin, protecting it from the sun, and doing antioxidants to this. It's not so easy. And as we age, the hands, what happens with the hands? The skin loses its elasticity. It gets thinner. You can almost see through it and translucent in some patients. You lose the fat that's in here. And as that fat goes away, you're seeing the tendons in your hands. You're seeing the blood vessels very easily. You're seeing all of these contours. So what we're going to talk about is just the skin itself. So if you're outside and you're working a lot and you're working outside all the time, you're going to want to wear gloves, right? There's nothing better than wearing gloves. I know it's a pain in the neck. I know it's tough, but if you're out gardening all day long, or if you're working outside in the sun all day long and you're getting sun to your hands, you're not doing yourself any favors, right? Don't come crying to me when you're 55 and you got little brown spots all over. The earlier you start taking care of this, the better off you're going to be. So if you're going to be out, wear gloves. Now, applying sunblock. Yes, you can apply sunblock. Yes, if you're at the beach, I'm going to tell you, use the less expensive, thicker, pastier zinc oxide. Maybe not white stuff, but just use that more tenacious stuff that doesn't wash off so much. But even during the day, if you can put your sunblock on your hands, don't forget to put your sunblock on your hands, but you realize it's going to wash off some. Now, if you're going to do antioxidants to your hands, sometimes retin-A, sometimes it can be a little too irritating down here, again, because the skin's so dry and stuff. But there's C and E's that are made, some C and E's are made specifically for the hands, right? So they're made to be a little bit more tenacious. They're made to stick on here. They're made to help maintain the elasticity in the skin, try not to make it so thin. Those C and E's that you're going to put on, you're going to put them on at night, right? So you're going to wash, do all your stuff, and the last thing before you go to bed is you're going to put that C and E on your hands to try to maintain this and try to keep this as good as you can. Now, the next thing is, so that's the hands, that's the C and E. The next thing we're going to talk about is my dog barking and driving me nuts. Hang on for 1 second. Lynn, come get this dog. Sorry about the intermission. All right, so we've talked about the retin-A's, we talked about the vitamin C's and E's, and all of these things are to maintain your elasticity. Now we're going to talk about collagen. Okay, so like the elastin, it doesn't last forever. You don't make it again. You've got to take care of it. You got to maintain it. Collagen is a different story, because throughout your life, as long as you're healthy, you're making collagen, right? You cut yourself, you heal by collagen deposition. So your body continues to make collagen. Collagen is the protein that gives your skin thickness. It gives it toughness. If you're looking at swatches of leather, right, for a couch, you're going to go buy a couch and you're looking at that swatch of leather. It's thick, it's tough, it does not stretch at all. That's all collagen, okay? So things that help with collagen, there's microdermabrasion, there's microneedling, there's chemical peels, there's enzyme peels, there's lasers, there's IPL, there's broadband light. There's all these fancy dancy Fraxels, like lasers that take a partially ablative of the skin, fully ablative of the skin. There's all these things. Well, what are they doing? They are all doing the same thing. They're all causing controlled injuries to the skin, which causes the fibroblasts, the skin cells, to lay down collagen, and it's causing the fibroblasts, the skin cells, to pull on the collagen, and it's tightening. So they're thickening this collagen level, they're tightening it, but they're not making it elastic, okay? Two completely different categories, okay? Tightness and elastic are not the same. So the way I explain this, an example would be you have a slinky and the slinky stretched out. You can cut out ends of the slinky and make the slinky tighter, but you're still not making it a good slinky, all right? So when we do microdermabrasions, microneedling, chemical peels, laser resurfacing, blah, 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 it's a spectrum of injury, right? So you could do little tiny injuries, like little tiny injuries stacked over time. And one of those little injuries, like a microdermabrasion. A microdermabrasion, for people that don't know what microdermabrasion is, a very simplistic way to think of it is like a little sandblaster. It's using like little crystals or a different material and suction to sort of abrade off the top layer of the skin. It might make you pink for a little while, depending on how sensitive your skin. Even shaving, right? So guys shave every day, well, most of our adult life. As we shave, that's causing controlled injuries to our skin. It's taking that dead layer off, and it's helping keep our skin tighter and thicker, okay? So, for example, what I tell people, women will come in with wrinkles of their upper right lip. And when they're 40, they'll say, I hate the wrinkles on my lip, and I'll put my glasses on, I'll look real close. I'm like, yeah, I don't see any wrinkles, but they'll purse, and then you can see the wrinkles. So that's what I call dynamic wrinkles. And what's happening there? The skin around the mouth is losing its elasticity. It's not contracting like a rubber band anymore. It's pushing up like an accordion. They're losing fat through here as well. And as those muscles contract, you're starting to see those little waves. Well, as time goes by, the skin gets thinner, loses elasticity more, and then those wrinkles start to become embedded in the skin. So when they're embedded in the skin, we do things like resurfacing and we do like injections and stuff like that. But the point of it is that this is losing its elasticity through here, right? And I challenge people, I'm like, well, women will come in and say, well, I'm not a smoker. It's like, I got the smoker's lines. It happens to all women. Yes, if you smoke, it happens earlier and it's worse. Yes, if you sunbathe and you get a lot of ultraviolet light, yes, it's worse and it's faster. But women get it all the time, regardless if they smoke or not. Then I challenge them, like, well, how many guys do you see with wrinkles of the upper right lip? And they're like, I don't see any guys with wrinkles. It's because we're shaving our entire life. This skin is thicker. We have hair follicles there. It's not losing that. We're keeping it tight and thick while doing that microdermabrasion with our razor. So microdermabrasions is like the one end of the spectrum where it's causing these little controlled injuries, little pink for 15, 10 minutes. With this low injury, there's less risk, less downtime, and it has to be stacked over time. Yes, you can do it once and your skin will be nice and shiny, but it's not going to make changes. You have to stack those modalities over time and continue to do them. And I tell people to play on synergisms again. If you're going to do your microdermabrasion, something mild like that, you're having your facial with your esthetician and you're having an acid peel or a chemical peel or a enzyme peel. You want to do the retin-A's, the vitamin C's and E's on the off times. Very important from those C's, E's, and A's that we talked about. If you are seeing an esthetician, if you are doing things like having things waxed, or having treatments done, it is very important that you tell the people that are doing these procedures that you're on the retin-A. so that they don't hurt you. You have to stop the retin A, the vitamin C and E, a week before you have these procedures and wait like another week before you resume it, okay? Because if you go too hard, you peel up, like if you're doing your retin A and then you go having waxing done, it's gonna give you a red mark there for weeks. So when you're doing the C's, E's, and A's, those medicinal things, you want to tell whoever your skincare person is, if it's a different person that didn't prescribe it, let them know that you're on those things and make sure you stop it a week before and resume it a week later. So the microdermabrasions, little injuries stacked over time. The other end of the spectrum, okay, laser resurfacing. Now, in the old days, and when I say old days, like the 1990s, we use CO2 laser, skin resurfacing. Very, very strong, went very, very deep, very good for deeper scars. And at the time, it was really the coolest thing going because people had these deep wrinkles of their upper right lip and you would laser them and the heat energy would remove the top layer of the skin and then it would denature the protein and the collagen and it would shrink the collagen and the injury would cause, like I said, fibroblasts to lay down collagen and shrink wrapping. The problem with that was that the downtime was 2 weeks, super, super long of putting Vaseline on your skin and hurt when you did it, so you had to be asleep for it. But the problem with it was that if you follow those patients out long enough, and I'm talking 5 years, a good percentage of those patients, the area that you treated would turn white and shiny. It would have this, not at a year, not at 6 months, not at 2 years, but further out, those areas would turn white and shiny and have this odd look to them. And I have patients that say all the time, well, I was in Florida and I was seeing all these patients, all their skin looks weird. That's that, right? So because of the downtime, and no one could give me 2 weeks of downtime anymore, and because of that risk of hypopigmentation, I don't do that super strong laser resurfacing anymore. So I do really medium depth peels, or medium depth lasers. I'm not gung-ho and going crazy. I don't want to make anybody white. And even if you could be lily white, and I can still make you whiter, right? So it's white. So you go to the other end, the medium depth chemical peel, medium depth laser. Now, this is going deeper. It is stronger, so it's causing a deeper injury in the dermis, into the skin. Longer downtime. Right now, you're putting Vaseline on for a week. Okay, you're taking care of it. It can be pink, and we can go over that. So it's a bigger injury all at once, deeper, stronger, bigger downtime, more risks. Okay, and so that's the other end of the spectrum. That's like a physician strength resurfacing. Again, it's making the fibroblasts, controlled injury of the fibroblasts, laying down collagen, pulling on the collagen. It's shrink wrapping. It's not making you elastic. So in that spectrum, you have like microneedling, which is sort of in the middle, downtime 4 days, 5 days. You have other different modalities, the Fraxels, again, fractionated lasers. I shouldn't say name brands, but fractionated lasers, fully ablative lasers, and all that type of stuff. The other end of the spectrum, if we're talking about that medium depth, what is that like? Well, in the office, you're awake, topical numbing medication a lot of times, sometimes injectable numbing medications to numb you up. You're doing these treatments afterwards. You're going to put Vaseline on your face because you don't want to let it dry out. And your skin's going to react. It's going to get swollen. Okay, sometimes it's oozy, depending if it's a laser or if it's a chemical peel. The difference between a medium depth chemical peel and a medium depth laser is this. And I have to say I'm very partial to chemical peels. I have a lot of experience with them. I know they're not fancy. I know everybody wants the newest fangled laser, but very safe, been around for a long time, very predictable. It tells you when to stop, where lasers don't. So when you're doing this and you're doing a chemical peel, chemical peel is just like pickling the skin. Just like if you're making a pickle, you're using acids to denature the pickle. You're using acids to denature the skin. But the skin layer is still there. So when you do the chemical peel and you put it on there, I'm watching that skin turn to a certain color. It's going to turn white. When it reaches the right color white, I'm going to stop it, right, and neutralize it with water. I'm going to put water on it and neutralize it and stop it. So I can see when that skin gets to the right depth, when it's right there, and I can stop it. Afterwards, it's going to turn reddish. The white will fade after 10 minutes, then it turns red. And then after a couple hours, it's going to look like if you've ever had a bad sunburn on your back, where the skin gets gray and blackish and it starts to peel off in little sheets, and you peel it off and the underlying skin is pink like a bad sunburn. That's exactly what it looks like. The skin starts to peel a little bit, like little sheets and stuff. So when you do the chemical peel, it's going to turn grayish. All the little brown spots that you have are going to pop. They're going to look darker. They're going to be blacker, right? So it's going to turn these different colors. The area that you treat is going to get swollen. I've done a full face chemical peel on myself 3 times, okay? And the 3 times, like what happens, my face gets swollen, my eyelids get swollen. This is my whole face. The skin gets peely. I'm putting Vaseline on it, right? Days 3 through 5, it's the scariest. It looks scary. It's swollen. It's got Vaseline. It's peely. It does not look good. I'm not going to go and teach a kindergarten class after having this done. It's not good, right? I can do it because I can still go back to work because I can show people, look, this is what it looks like. I do it to myself. Yeah, I look scary, but that's a chemical peel. Now, the chemical peel, when it's after days 3 through 5, that skin's going to start peeling off. The swelling's going to go down. And by day 7, the peeling is mostly resolved. The skin is the swelling's gone down, and now it's just slightly pink. At that point, that's 7 to 10 days, I'm going to stop that Vaseline, and I'm going to start putting a thinner moisturizer on there and start using a very, very mild cleanser. From the time that I do that to 3 weeks later, you have to baby that skin. You can't get sun to it. You can't put makeup on it. You can't put sunblock on it. You can't put any chemicals on it. You have to baby it. I only do resurfacing in the winter months from October to May, because if you get sun, it'll turn things brown. It's not good. It doesn't play well with it. You can't put sunblock on. So the chemical peel pickles the skin, peels off. It's not an oozy thing. When you do a medium depth laser, what is it doing? Instead of pickling the skin, it's again it's using energy, light energy, to cook off the top layer. So it's evaporating the top layer of skin. The lower layer is getting shrink wrapped and injured a little bit from the heat of it. But now, because the top layer is off, it's more oozy. All right. And what does that translate to? Well, when you're putting your Vaseline on every hour, you might have to soak it more. You might have to clean it more. A little bit more labor intensive. Same time frame though, right? 3 to 5 days looks scary, swollen, oozy. You're keeping it clean with the distilled water and white vinegar. By day 7, it's just pink. The skin's healed up enough. It's good, but you still have to baby it for the rest of that month, right? For the next 3 weeks, keeping it moist, happy, no chemicals. If you're going to wear makeup, you have to wear a mineral-based makeup with no preservatives that's specifically made for resurfaced skin. Because if you go put makeup on that's got preservative in it and you have an allergic reaction to it, you're going to be red for months. Now, if you don't put the Aquaphor, the Vaseline on it, and you let it dry out, you're going to be red for a long time. You peel that skin off before it's ready, you're going to be red for a long time. You scratch it, you're going to be red for a long time. You have a dermatitis to makeup or a sunblock, you're going to be red for a long time. So it's all about taking care of it and babying it. And there is a downtime with that, right? So microdermabrasion, esthetician grade chemical peels, enzyme peels, no downtime, stacked over time, slower results, synergistically with those antioxidants, low risk, low downtime, but it's a commitment of time. You have to come in every 4 to 6 weeks. Not everybody's good with that. Some people I want this done. I don't want to take care of it. I just want it done. All right, we're doing that chemical peel, we're doing stronger, we're having that downtime. So a lot of times when I do this consultation, it really, I talk to people for an hour. And during that hour, I'm trying to learn them. I'm trying to learn what their lives are. Are they able to do these things? Like, so I might give you an acid, I might give you a whole skincare regimen that's going to take 30 minutes in the morning and 30 minutes at night. And you might have little kids that you're putting on the bus and you don't have 2 minutes to breathe, right? You're running around. You don't have morning time in the morning. You don't have time at night. I just sold you this product line that you're going to be non-compliant with just because your life doesn't allow it. So there's no point in doing that, right? So that person who's running ragged all the time, you know what? It might be better for them every 4 to 6 weeks to carve an hour out of their day of just their me time, right? Or 1 hour out of that 4 to 6 weeks, I'm going to go in, I'm going to have that esthetician, I'm going to relax, I'm going to be pampered, and they're going to take care of me, okay? Then there's other people that, you know what? They have 30 minutes in the morning. They have 30 minutes at night. That skincare product line, they're going to be diligent. They're going to be compliant. They're going to put that on there. And that's a really good thing for them, right? They're going to do it. And in their lifestyle, it works for them. So part of, there's many different ways to achieve a goal. There's no one way. There's no one machine that works really well. That's the only way of doing it. There's many different ways. The key to it is finding out what is going to work with your lifestyle, what's going to work with your budget, and that you're going to be compliant with. And that is really where the conversation starts, and figuring it out and doing that. And that's the key. The key is compliance. The key is finding something that works well for you, and that you're going to do, and that you're going to be able to stick with that. And that's, I'm going to do one last thing. I'm going to talk about the onslaught of media and advertisements and social media selling you stuff and selling you more stuff and selling you more stuff. And it boggles my mind, because it's gotten to the point where all these companies that make all these different newfangled things, they're driving the trends, right? So I make a new laser and I find this doctor in Hollywood. I get this doctor in Hollywood to be on an article in a very fancy magazine. And they talk about how, everybody, everybody cares about their skin now, but nobody wants any downtime, zero downtime, and they don't want to take any time. And we have this new fancy laser that's going to do this, and it's going to have zero downtime, and it's going to blah, blah, blah. Well, guess what? If it's too good to be true, it's not going to, like, if you've got $1 zillion and 1 zillion hours of time and you want to waste all that, and if you're going to go do this fancy, this is the fancy thing, I read this in this magazine, and it's going to do all this, it's going to make my skin glow, and it's not going to do it, and without any downtime and no irritation, it's not going to, you're going to not see much value in that. I can guarantee you that. You're not going to see much value in that. I mean, you could do a microdermabrasion with an esthetician and do these fancy lasers that have no downtime and no irritation and doesn't hurt anything, and spend money for the physician or the nurse that's doing it and pay for the $150,000 laser, okay? That's all built into that price. Or you do that microdermabrasion and you're getting the same results. So, everyone's so gung-ho on the newest technology and the newest thing, and this is this fancy thing, and it uses ultrasound or it uses radio frequency. Be careful of that. Don't buy into it. And what I tell people is, this is what I used to tell when I used to give talks, is that when you see this new technology, all right, I want you to wait a couple years, 2-3 years, right? If they're still advertising, if after 3 years, 2 years, they're still advertising like crazy, send your girlfriend, let her go first. And if she turns out all right, then you can do it. You don't want to be the first person like on that cutting edge and do that. That never really works out too well. You want to stick with technology and things that have stood the test of time, that have a track record, that we know are safe, that we know, like for example, the CO2 laser way back in the 90s. Super powerful, really cool. You could shrink wrap everything. Looked good at a year, looked good at 2 years, looked good at 3 years. But when you saw those people back at 5 years, 6 years, 7 years, 10 years, and now their skin is white, 20% of the skin is white, you're like, whoa, wow, I didn't see that, right? So great technology, super powerful, but at the end it was a little bit too strong for what we were doing. So be very careful of new technology, be careful of the advertisements. A lot of it is sales. And I guess the key thing is find someone who you trust, find someone who you can talk to, find someone who's not just trying to sell you everything under the sun, find someone who is willing to say no, and work with them and communicate with them, tell them your life, tell them your goals, and I think you'll have more success doing that. So that's it. I've gone over for quite a bit. I don't know, I was hoping to try to answer questions, but I have to put my glasses on to read the questions. So if there's any questions, just email us at info@stanislawmd.com. Again, we do this every second Thursday of the month at 7 o'clock. We try to do different topics, and I don't know what the next topic is for next month, but we'll post that. We'll disseminate that, what the next topic is. Thank you all for joining me tonight. And again, if there's any questions, just email us and we'll try to answer those for you. Thank you and have a great night.